Now look at this. All groups showed a statistically significant improvement in reversing markers of skin aging. Today I want to share with you an article that has big implications for your skin, for your skincare, for your glow, for wrinkles, fine lines, and here's the kicker: dermal thickness. The holy grail is getting the dermis thick, meaning your skin, and of course rejuvenating and protecting your fat pads. Let's dive into this article. It's something that you can use at home. It's inexpensive. Here's the thing: you probably already have it in your cabinet and you didn't know it. Maybe you're not using enough of it. Maybe you put it by the wayside, or maybe you're using it and you want to use it and take it to the next level. At the end, I'll tell you exactly how to step it up. Look at this depiction. This is exactly what we're going to talk about reversing. On the left is younger skin. On the right, look at the top. You see the wrinkles in the top of the skin. That's because look what decreases: hyaluronic acid, elastin, and collagen. Even the fat becomes less healthy. Now, for those of you with a graphic mind, this is important. Look on the left, in your 20s, you see how in the 20s, you're getting depletion of some important levels. That's why people are starting earlier and earlier on prevention skincare. Look at the 30s and the 40s, but then things plummet in the 50s. Check the green line out. You see that regeneration repair phase goes down? That's why PRF and plasma fill are so important, because the regeneration and repair slows down. But check it out. What goes down is immunity, skin thickness. That's what we are reversing today. Regeneration, repair, collagen, and elastin. Look at the moisture retention. It plummets in the 50s. That's largely due to estrogen loss, but a great moisturizer is important, and of course, organic seed oils to help replenish this. Let's look at this article. So here we have the effects of an estrogen and glycolic acid cream on the facial skin of postmenopausal women. So that is the study. It doesn't mean you have to be postmenopausal, meaning for most people after the age of 45, 47. But let's study the most difficult population, because between 45 and 55 is when the most changes occur in the skin. So that is a benefit of looking at an article where they are using people, women, whose actually skin is thinning at the same time as they're treating them. That's the most difficult thing to do, because you're trying to overcome a process that's occurring during the study that's detrimental to the effect of the product we're testing. So you can see this is a prospective, randomized, double-blind study. We like that. That means it's forward-looking. It's randomized, so they took a group of people, they randomly put them into different categories, who gets a treatment and who doesn't. It's not like they took the best people and put them in the group. They wanted to see the outcome, so they just randomly put them in two different groups. You can see there were 65 patients that applied a cream containing 0.01% estradiol cream. Now, this is a cream that's readily available, that is used typically for vaginal applications, but you see so many people putting it on the face. Estrogen cream on the face. You either get it that way, or you get it compounded from a physician or naturopathic doctor who prescribes it for you, versus, and this is good, we get the dose here, 15% glycolic acid. So just glycolic acid, keeping in mind, creams that contain glycolic acids often have other acids like salicylic, like malic acid, lactic acid, and other like passion fruit or grapefruit extracts that work synergistically. But again, they looked at a difficult thing, just glycolic acid alone. And they also looked then at a group that used both of these, the estrogen cream and the glycolic. So we have three groups, one that used the estrogen cream, one that used the glycolic, and the one that used both together. Would they be additive? Now look at this. They even did a 2 millimeter punch biopsy from the hairline of each patient to check. So not only was it, hey, did people look better, but they actually looked at a sample of the skin. Very difficult to do. Would you give a sample of your skin for a skincare study? I study my skincare products in my clinic. We do questionnaires. We do 3D imaging analysis, but not many people want me to take a piece of their face to analyze it. Very good study. Now check this out. The estradiol treatment produced a 23% increase in epidermal thickness. We're reversing skin thinning with estrogen cream. Maybe not a surprise to some of you because I did a poll. Many of you are on estrogen creams, but of course they have implications for systemic absorption that people aren't comfortable with, meaning could they cause breast cancer, uterine cancer? What if you've had breast cancer before, or a family history, or a genetic predisposition? A lot of people don't then want to go on the estrogen cream because there is some data for absorption into the body, which could be dangerous. So that was a 23% increase in epidermal thickness. Look at the glycolic acid, a 27% increase in epidermal thickness. Let me repeat that. The glycolic acid did better than the estrogen cream. So if you don't want to take the risk of an estrogen cream, no problem. Go on a glycolic acid. Now, what if you combine these two? This is fascinating. A 38% increase. So let's call that almost 40%, almost doubling. Now we're stretching it each time, but you see that's unbelievable because during the first year of estrogen deficiency, many people lose 30% of their epidermal thickness. It's devastating. That's a time when most people come into clinics like mine. I'll share something else that I see in clinic as well. A lot of times they're not doing a basic skincare routine. They're not using the basics of skincare like I talk about here in the channel. And glycolic is one of the missing ingredients of most people that walk into my clinic de novo, meaning new people I haven't seen in many years or new patients. Now look at this. All groups showed a statistically significant improvement in reversing markers of skin aging. So there you see the power of glycolics. Now, if you're not on a glycolic acid product, what I like and what I put in my product is glycolic acid, salicylic, so it gets the pores, malic acid, lactic acid. I put in passion fruit and grapefruit extracts, other plant extracts of acids to work synergistically. So you get browns, you get even feeling to your skin. It feels smooth, it looks smooth, it reflects light, and that all gives glow. So you can see now also glycolic acid increases epidermal thickness. Now, how do you take it to the next level? Well, you want to use glycolic acid peel pads, and these come pre-moistened in a container, and this can last you a year for many people. And you apply them once or twice a week within your skincare routine, or you can also use them as peel pads and use them 3 to 7 days in a row, depending how sensitive or not your skin is, or how oily it is. So less oily, more sensitive skin, you can 3 or 4 days, you'll start peeling. More robust skin, you can use it for 4, 5, 6 days. And then after that, treat it like you've had a chemical peel. Just moisturize your skin for a few days. Use your SPF, but those are 2 ways to use it. Incorporate it in your skincare routine, or then you can also use peel pads as a mini peel, and you don't have to go into the clinic. It is very, very inexpensive. Don't forget, for your best skincare, go to quizmd.com. There you're going to answer a few questions, and in under a couple minutes, you're going to get a result for skincare, for exactly your skin, for exactly what I would recommend to my patients in my clinic with your skin type. Now you're going to want to watch this video on how you can take your retinols to the next level, and one down here on how to maintain and increase the fat pads in your face so you look beautiful, keep your skin and body beautiful, healthy, and vibrant.